Hi, I'm Lindsay Barrera, an orthopedic surgeon, fellowship trained in sports medicine, and I'll be talking to you today about distal biceps tendon ruptures. So this is an injury that we commonly see in patients who are lifting heavy objects, weightlifters, moving a heavy piece of furniture or a heavy box. It most commonly occurs with an eccentric contraction, so not as the muscle is shortening, but as it's lengthening. So as you go to set down that object or bring the weight down, that tendon can rupture from its insertion site on the radial tuberosity. This typically presents with a pop, pain, swelling, bruising over the elbow area. The muscle can even retract and ball up into the arm, which we call a Popeye deformity. Treatment for this most often is surgery, just because of the amount of strength that is lost when your biceps tendon ruptures. You'll have difficulty with activities involving elbow flexion and supination, turning the palm up. So opening doors, opening cans, turning a screwdriver, or lifting anything heavy are going to be hard without that distal biceps attachment. So surgery involves making a small incision at the elbow and reattaching that tendon back to its insertion site. Occasionally, in older, more sedentary patients, these can be treated without surgery, but the majority of time it does require surgical repair. And time is of the essence in these injuries, just because the longer we wait, that tendon can retract further up the arm, it can scar into place, and it just makes it that much harder to get that tendon back into place. So if you think you may have injured your distal biceps, please come see us at OrthoGeorgia.